This episode of Fertile Talks is sponsored by ILMeds.co, an international mail order pharmacy specializing in fertility medications. If you're looking to save significantly on your fertility treatments without compromising on quality, ILMeds.co is an excellent choice, offering up to 80% of retail prices. And as a special offer to our listeners, use the code FT24 at checkout to receive a $50 discount on your order. For your convenience, you can find a link to their website in the episode show notes. Thank you, and let's get started. Welcome to Fertile Talks, the global podcast celebrating the diversity of fertility journeys. I'm your host, Dr. Yemi Famuyiwa. Whether you're just starting or simply curious, this is your safe space. In each episode, we will bring you expert insights, heartfelt personal stories, and the latest in reproductive health. Our goal is to break down barriers, tackle stigma, and provide support and hope. So, whether you're in the Americas, Africa, or Asia, Fertile Talks is your companion on the path to parenthood. Thank you for tuning in and welcome to Fertile Talks. Hello, everyone. This is yours truly, Dr. Famuyiwa, with another episode of Fertile Talks. And today we have an exciting guest I want to share with you. His name is Dr. Amin Herati, and he's going to talk about himself in a second. And the funny thing is, we are LinkedIn friends, and I went to SRM, and so this gentleman comes up to me. He goes, "You're Dr. Famuyiwa." I'm like, "You look so familiar." He goes, "I'm Amin." I'm like, "Oh my God." Anyway, so he's here today, and he is the director of male fertility at Johns Hopkins University. And he's a fertility expert for the gentlemen. So I focus on the ladies, he focuses on the gentlemen. And Dr. Harati, please welcome to Fertile Talks.
Thank you so much for having me.
Yes. Can you tell us a little bit about yourself, your background, and your training? People always want to know, what is a male fertility specialist?
Sure. So I've circled the United States. I was born in Alabama. We moved to Missouri. I did my medical school in Kansas City. I was a 6-year medical school graduate from University of Missouri, Kansas City. And during medical school, I took a gap year, went to New York and did a gap year with Dr. Lou Cavusi, who's a pioneer laparoscopic surgery in New York.
Wow.
And I went back to Kansas City, finished medical school, and then that was where I ended up going back to for residency. And with his mindset of pioneering and research, it became my life mission to continue in the same way in terms of doing innovative research and looking into challenging problems. So during residency, I went to Cornell. I did a lot of research and the cutting edges of male infertility and male factor in Cornell. When I was a resident, I worked with our fertility specialist at Northwell, Dr. Gilbert, as well. And from there, my interest in fertility and sexual reproductive health kept increasing, and I ended up having the fortune of matching at Baylor College of Medicine with Dr. Larry Lipschultz and Dr. Dolores Lamb, who are also leaders in the field of male infertility.
Awesome.
So I did a 2-year infertility fellowship there, which was NIH sponsored and funded, which gave me the opportunity to protect my time and really focus on the science of infertility. So I'd spend 80% of my time looking at the tail of the sperm and looking at a specific protein called the intraflagellar transport protein, and how when the body is regenerating itself, there are a lot of proteins that can go and replace proteins that have already done their job and are broken down and they need to be replaced with a new protein. This gene that we identified as the cause of male infertility was defective in this family and a cause of their infertility. So I got to really dive deep into that gene and studied that process extensively, and through that I really felt like I took away from that experience a much deeper understanding of how genetics interplays into infertility and
Yes.
how a lot of
Yes.
these issues can arise that can affect one's ability to have children. So men are 50% of the equation, and
Oh,
and
yes.
managing very effectively the other 50%, but together you have to really have both sides working
Right,
optimally in order to get
right.
the best outcome. So I went from Baylor to Johns Hopkins, and I acquired the position of the director of men's health and male infertility here. And I've been overseeing my practice with my nurse practitioner. We have a pretty high volume, and I would consider a successful practice here, where we're seeing a lot of guys who come in with all spectrums of infertility. We've got the most severe forms and down to the mildest forms that just need a little tweak of a lifestyle recommendation.
Wow, that is so exciting, Dr. Herati. In fact, as you were speaking, so many questions were bubbling in my mind. The first thing is you talked about this protein in the tail that is rampant in the family that you worked with. Is there a way to test for if is it a carrier base? Is it autosomal recessive, autosomal dominant, and can it be tested for?
Yeah, so great question. Part of the challenge of studying the genetics of infertility is genetic conditions tend to breed themselves out.
Yeah,
And which is why we've only identified
right,
in the double digits, like 10 to 15 genes, that we can conclusively say this gene was identified in this family and confirmed in an animal model. Because what happens is that if you do sequencing studies where you sequence out the DNA of a
right,
family, you may or may not find a gene mutation that is of significance, because you have to find that gene mutation in that specific sequence and then test out that specific sequence to know, did that one single change in the sequence lead to a deleterious or a functional change, which basically means that when that mutation occurred in the sequence, did it alter the function of
right,
that protein in that cell in a way that
right.
makes the whole cell not work, or the whole
Interesting.
process shut down. So
Now, are you finding that's really well? Let me let you finish that because another question just bubbled into my brain just now.
no, no. So the short answer to that is that we have for what's called whole exome sequencing, where you can sequence out the DNA, but it's not part of a specific gene test currently.
Talk to me about you had mentioned something about the Y chromosome is shrinking. Can you explain that to me?
Sure. So the Y chromosome is a fascinating chromosome in the sense that there's only one type like it. In uh, females, there are two X's, and in
Correct.
men, there's an X and a Y.
Right.
So when the X chromosomes are replicating, they can replicate and do what's called recombination with each other. So they have
Right.
a bonding partner that they can exchange information with and conserve a lot of their sequences.
Right.
But for the Y chromosome, there's no analogous chromosome to bond with and do recombination. So a lot of the genetic information can be lost through the way that the chromosomes will exchange and split information. So the Y chromosome is very sensitive and has been sensitive for millions of years to mutations that can occur that would take out arguably a lot of the unnecessary genes, the ones that are the most necessary for mankind to persist, for fertility to be preserved, for testosterone production to be preserved. Those are well protected. And if they were affected, then that, as we had talked about before, a lot of these mutations will unfortunately breed themselves out, and people who have
Right.
severe male factor can have trouble having kids on their own, and that mutation doesn't persist.
Oh,
But if you look at the way that the Y chromosome was, for example, 6 million years ago, it was potentially 97% longer than what it is now.
yes.
So
So
it's
where is the shortening happening?
it's happening in a lot of the non-critical genes that will span those critical regions. So it's cutting out a lot of the introns and a lot of some of the genes that are either redundant or unnecessary. So we've potentially we could call it more, making it more efficient and condensing it down to just the high yield and the most important parts. But it's lost a lot of length because of the fact
Wow.
that it's so susceptible.
Is that happening to anything to do with telomere shortening that we see in other parts of aging or no?
One of the interesting things about sperm is that as a man ages, the telomeres lengthen. So when somebody has kids at older phases of life, their kids inherit longer telomeres. But that, if you look at studies like the what's called the PLCO, which was a cancer trial where they looked at cancer risk for various cancers, it was interesting that they had looked at that to see whether age was a predict of paternal age is a predictor of cancer detection for the offspring, they found no connection between the two. But when the telomeres lengthen, that can potentially fight against some malignancies, that can fight against some aging conditions. So, am I saying that that imparts a survival advantage? I don't think so. But
Okay.
but the telomere does lengthen over time, so it's opposite of what happens in other cells of the body.
But comment. One of the things that there's been in the literature evidence that, for instance, men's grandfathers were more fertile than with the men we're seeing nowadays.
I absolutely think there's truth to that. There's likely a lot of lifestyle changes that have occurred since. There's a lot more chemical and toxin exposure. There's a change in. I don't think that it's attributable to necessarily better genetics, but I think the lifestyle has made a
Has
tremendous impact. And
Yeah, it's so funny. I was reading where they found microplastics, for instance, in sperm,
yeah,
in testicles as well, which is scary.
yeah, questionable the significance of it. It's hard to know if that's having any sort of direct impact on the sperm,
Right,
but
right,
it would be foreseeable that it could have an impact.
right, right. Let me ask you a different question. Are you seeing, because one of the things I'm very passionate recently on, I've been working with the American Board of Precision Medicine, and we're looking at exposomes, meaning what people are exposed to. And there are people in our group that are taking this exposure and trying to correlate it with changes in the DNA. Are you finding any correlations in the exposome world, in the environment, in what people do or exposed to, that may directly tie to some of these DNA mutations?
No, absolutely. So you can look at it from a multitude of ways, from occupational exposures, from social exposures. So occupational exposures could be if somebody is working in for example, in a food truck. I think of a recent example where a patient of mine said that he's in a hot truck, and
Yes,
that hot truck, as he's cooking, that heat is causing what are called heat stress proteins, and those
yes,
proteins and the oxidative stress that can come with that can ping the DNA and fracture the DNA. There are things that we see on a day-to-day basis that are completely dietary and lifestyle related. Like if somebody eats a high-fat, processed food rich
right.
diet, you can actually see changes at the genetic and what's called epigenetic level. So the next
Yes,
layer of the DNA, where tiny little particles of RNA called microRNA can
yes,
change the way that the DNA opens and closes to
exactly.
allow some genes can open and close, and that happens within the testicle. But that same level of genetic information can also occur in the epididymis. And what's really interesting is that when these exposures happen, those changes get passed on generation after generation after generation after
Yes,
generation. So we
that
are,
is so great. Yes,
yeah,
that's
so we're,
fascinating. Yeah.
yeah. So our health is the direct manifestation of what our great, 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 great grandparents were doing.
Yes, yes. In fact, there was a study I was reading where they looked at men, I think it was done in Europe, where they looked at men through the Great Famine and then looked at their grandsons. And the ones who went through certain famine at a certain time was reflected in the DNA in their grandsons. That
Hmm.
is just so crazy. But one of the things that concerns me now, and I'm, standing on my soapbox and I've been talking about it, and if no one's listening, unfortunately, is this epidemic we have of vaping and marijuana. Are you seeing any effect of these on sperm?
So the hard part is you can't see it in the semen analysis,
Hmm.
but you can see it in outcomes. So when I'm
Right.
sure you've seen it, and when I've seen
Right.
it, when patients go through natural conception cycles, cycle after
Yes.
cycle after cycle, they're not successful.
Yes.
So, and they get a semen analysis, and everything may look fine.
Fine. Exactly.
So
and
that's
and
the
then and
structure
then I
check.
and then I have to tell them, yes, yes, your semen analysis is fine, but what else are you doing? Can you give it up? And people tell me, oh, before I go into when they should give it up, another thing that patients are coming to me is the so-called male vitamins, meaning
Mm.
they're getting something bootlegged off the internet and it's pure testosterone. Can you comment, or do you see that in your practice as well? Men
Yeah,
taking testosterone?
So luckily I haven't seen it that often. I think part of the reason is that the female partners are watching over their male partners like a hawk. So they're luckily doing a lot of the policing before the patients get to us. But I have had some patients who were taking supplements that they didn't realize had testosterone from the gym. I think one patient of mine thought that he was taking growth hormone, and in the growth hormone was likely some testosterone. But usually we can tell if somebody comes in with testosterone exposure because of the fact that their hormones from their pituitary gland, what's called
Suppressed.
luteinizing hormone, follicular hormone, all those are suppressed and their testosterone is sky high. And they come in typically looking very
Yeah,
much
exactly.
like a bodybuilder. So
All
we
right.
see that in a lot of guys, but it's not uncommon for us to see guys on vitamins. And it's actually very, very common that before they even set foot in our practice, that they're already started on 3 or 4 different vitamins that they've sought out through online pharmacies or
All right.
discussions in forums. So it's very common to see that.
All right.
Luckily, we don't see testosterone
Right.
therapy, but
Now, I'm not saying that vitamins are bad. There are some vitamins that are good that have antioxidants, right? But it's when people go to this other non-medical route and they put stuff in there that they don't even know that it could harm them, right?
absolutely.
So that's one of the things I care about. Yes, go ahead.
I think even vitamins can be harmful.
Mm.
Yeah, one thing
Explain,
that,
elaborate
yeah.
on that.
So one of the things that I tell my patients is that your body is designed to extract the nutrients it needs from the foods. So if you can optimize your diet, you can get the majority of the vitamins that you need at a level that's more balanced for the body. The reason you can sometimes tip into too much antioxidants is if you think about the way that the cell develops, the cell initially
Yes.
comes as this plump cell, and then it contracts down, contracts down, contracts down until you get to a tiny little cell that's lost almost 99% of its cell volume.
Mm.
And in that loss of what's called cytoplasm, or that substance around the nucleus, that cytoplasm contains the enzymes that produce antioxidants.
Right.
So that final cell has it should have the right amount of antioxidants relative to the amount of oxidants because you need some oxidants to carry out sperm function. So for
Absolutely.
sperm to be able to achieve what's called capacitation or hyperactivation, egg penetration, all these steps require some level of oxidative stress.
I
So
think I agree with you because there was an article that came out that too much of antioxidant can cause the opposite, which is a redox stress. I think
exactly,
that's what you're talking about. A
exactly,
redox stress. Is that
yeah.
measurable?
There are some tests that measure oxidative stress, but one of my criticisms of the infertility field is that we hyper focus on one end of the spectrum and we don't look at the other end of the spectrum. And one of the things that I tell patients all the time is that you come in, if a patient comes to see me and he has, for example, 80 million sperm with 80% motility and 1% normal morphology, the concentration is amazing, the motility is amazing, and the morphology is low. The 80 million sperm per milliliter and 80% can actually be bad. When you have too high of a number, it can mean loss of quality control. So that's me editorializing a little bit and going off topic, but we tend to over fixate on the end
Oh,
of things that we can measure, but we don't measure the other side. So in your
very good.
example, reductive stress, we measure oxidative stress molecules, but
Yeah.
uh, there's no test to my knowledge that assesses
Right.
the
It's hard to
opposite.
measure, isn't it? It's
Yeah.
hard to measure the redox potential. So I normally tell patients, don't, like I have a bias against vitamins that have carnitine in it. And
Hmm.
I tell them, don't take it if your motility is fine. Because people say, well, I need to take it. It's motility support. Yes, if you have really bad motility. But if your motility is fine, then maybe taking L-carnitine may actually push you into what we're talking about, which is redox stress, the opposite of oxidative stress. I'll be curious if someone's doing research out there to see if this thing can be measured. Can we find a way to measure our oxidative and redox and I'm just thinking off the cuff here. Wouldn't it be nice if people actually knew so they don't swing like a seesaw, go too off one end. Now, let me segue a little bit. I'm going to talk about azoospermia,
Can
no
I give
sperm.
a quick shout out to the company Fertilix, who they have a PhD who's actively researching this. So
Wow.
Fertilix. They they're passionate. They come. The owner of the company, who's I believe a biochemical engineer, and his PhD colleague, they come to all of our fertility meetings and present papers and posters and attend the sessions. So it's very refreshing to see somebody in that. I have no
Who's doing
relationship with them, but I admire their connection to the field and their enthusiasm.
Yeah, I'd like to contact them and see is anyone measuring this redox potential? I'm just kind of curious. How do you measure the oxidative balance or or how do you balance it? And that's going to be something that I'm going to be looking at going forward. I want you to comment a little bit about azoospermia. Like I saw a gentleman today who his ex-wife died, or not ex-wife, his wife died. He's a widower, and he's happily married after almost 50 years to his soulmate. And I had treated him many, many years ago. He has a 20-something-year-old son from IVF I did when his wife was alive. But then back then he had sperm, and he's in his early 60s right now. The wife's younger, and I tested him, and I have no sperm, no sperm. Can you comment a little bit about azoospermia and also azoospermia as people age? What happens with aging there?
Yeah, so interesting. If you look at studies that analyze the trends of concentration, motility, morphology, they actually show very stable rates across the lifespan of a male. So one wouldn't expect, like women, where they're
Where they run out of
oocytes,
eggs. Yes, yes, yes.
exactly. That luckily men's sperm have almost immortality, or they should have immortality. Well, you can see a little bit of a drop off in the motility. You can see a small drop off in the concentration, but it would be unusual for
Age.
azoospermia or absent sperm to develop just as a function of aging. One thing that a lot of men pick up what are called comorbid conditions, where they
Exactly. High
develop new
blood pressure.
diagnoses, blood pressure meds, low testosterone. But one of the most common things that we see affecting people of all ages, and I know on the OBGYN side, you're likely seeing this too, is called pelvic floor dysfunction.
Right. Yes.
But pelvic floor dysfunction, when it kicks in, it can kick in, and for kids, it can kick in for 20-year-olds, 30-year-olds, 60-year-olds. And when those tight pelvic floor muscles that spasm in pelvic floor dysfunction, when they spasm, they block the return of blood from the testicles back up towards the heart. So if that blood gets blocked, it pools in the scrotum and it causes what are called varicose veins.
Right.
And those dilated veins can put additional stress on the sperm. So in addition to all the life stressors that a
Going
man
on.
would go through with all health conditions and chemical toxin exposure on top of it, you get a higher likelihood of what are called varicocele veins or varicose veins in the scrotum. And that is the one of the more common causes of the sperm to diminish in number.
Right. 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 So, in fact, some people have said, it's been said that your semen analysis could be a vital sign, right?
I agree
It's
with that
cluing you in.
1000%.
Something is going on. It doesn't maybe have to do with sperm, but something is going on with the whole body, the organism, and it's showing up in the semen analysis, correct?
Couldn't agree more.
Yeah. So if semen analysis is off, then we need to go hunting to see what's wrong with this gentleman. What else is a comorbid thing going on? Is he out of control? Does he have that out of control diabetes, high blood pressure? What else could be going on that's causing this?
Absolutely. Testosterone levels, fertility levels, all these are indicators of the likelihood of other health conditions to be present, malignancies to be present. So there's a colleague and friend of mine, Dr. Michael Eisenberg from Stanford, who's looked at the correlation between the severity of a semen analysis and the likelihood that one would be diagnosed with a type of cancer, whether it's testicular, blood. So they have a higher likelihood of developing a malignancy if the more severe their male factor infertility is.
So out of curiosity, for gentlemen who are thinking one day they might want to have offsprings, should at least get a semen analysis done, correct?
Absolutely. I'm a little aggressive in the sense that I'm of the mindset that and I think a lot of people would disagree with this, but I think that healthy 20-year-olds should get a semen analysis and they should even consider freezing some sperm just to have in the bank because who knows what can happen over the course of one's life. And at 20 years of age, that sperm will likely never be healthier than it is at that age.
You just hit on something that I touched on this. I did a podcast episode on this with Seattle Sperm Bank a few months ago. And I mentioned that. And I said, gentlemen, just as we're telling women to freeze their eggs, perhaps you need to freeze your sperm. But I don't think there's enough of a clarion call. I don't think people are hearing that.
Yeah. That actually led me to become an advisor of a company called Daddy, which was acquired by Roe. I reached out to the CEO of Daddy, DADI, several years ago, and I said, is there any interest in developing a program to outreach to colleges, to students at various levels, and to be able to get that message out there that
Hmm?
you have an opportunity to get your sperm at the healthiest
Yes,
level. And while you may not use that frozen sperm,
it's
but
there.
a lot of people who get that sperm at least have that peace of mind knowing that they have healthy sperm that may not pass on as many mutations. And to put it in perspective, for every year that a man is alive, he will pass on two new mutations to his offspring. Whereas for every year that a female is alive, it's only half of a mutation. So it's
Incredible.
four times more mutations per year of life that get transmitted to the offspring. And that just keeps increasing over time.
So, gentlemen, please get your sperm frozen while you're doing that. This is exciting. This is really exciting that we can talk about Dr. Amin. So, I think that I think we're I'm excited about what we're learning. Um, so, how can we get a hold of you?
Yeah, so my probably the best way to reach me, you can reach me through Twitter, and I'll provide my information for my social media handles for Twitter and for other social media sites like LinkedIn. That's probably one of the easiest ways to reach me. My email can sometimes filter out a lot of the outside emails, so it's probably not the best way. But if somebody wants to see me as a patient, our appointment line is readily available on the Hopkins Urology website.
Excellent, excellent. Thank you so much. Thank you so much. This has been really exciting. So you're gonna let me know how people can get a hold of you, how patients can find you if they want to call you. Where can they go to find you?
So I have an office at the Johns Hopkins Fertility Clinic, adjacent to the REI clinic here. We're in Pavilion 3 of Lutherville, Timonium. So
Awesome.
it's north side of Baltimore. It's very scenic out there, has a lot of open
Yeah,
space and a lot of great restaurants. So it's pretty nice and relaxing to come out there. And we have everything basically there: blood work, ultrasound, semen, and our andrology lab is out there. So we have all the testing that we need out there, and we have a surgery center. So if somebody needs any sort of fertility work, everything can be done there as well. So it's a very nice one-stop shop for all the services that one would need. So the physical ability to find me would be at the Johns Hopkins Pavilion 3, either Pavilion 3 in the surgery center or in the urology clinic.
thank you so much, Dr. Amin. Thank you so much. I'm very appreciative of you spending some time with us. And hopefully, we'll get to have you come back again.
Yeah. Thank you so much for having me.
All right. Thank you for tuning in to Fertile Talks. We hope today's episode has provided you with valuable insights and support for your fertility journey. Remember, you are not alone. Now, if you have any questions or topics you'd like us to cover, please simply leave us a comment. And please don't forget to like, share, and subscribe with a friend. Your ratings, your shares, and your reviews are greatly appreciated and is going to help us serve more of our listening audience. Thank you once again. This is Dr. Famuyiwa.